Yeah, hello everyone. This is Prashant Bandal, founder of MAS Pilates and Fitness. I have been teaching Pilates and other form of exercises for past 18 years. And I have done my trainings in strength and condition. I have done my Pilates training from the various teachers, and I've done my master training from USA. So I conduct a teacher's training. In our last episode, we busted a few common myths about Pilates from it's only for a flexible people and it's too easy to make a difference. Today, we are taking a step further. Let's talk about something super important: injuries and how Reformer Pilates can support you managing, recovering from, preventing them, and whether you are athlete recovering from surgery or just dealing with a everyday aches. This one for you. Why Pilates is ideal for injury management. Reformer Pilates provide a control, a low impact movement. It allows the targeted strengthening without stressing the injured area. It helps you to rehab muscles important that often causes you injury. A build core stability, a joint mobility, and a body awareness. And all these key factors are really helpful for the injury recovery. These are the common injuries are addressed by Reformer Pilates or the Pilates equipment. Low back pain improves the spinal alignment, strengthen the cores, relieves the pressure on the lumbar. So in the training, we're going to teach you how to stabilize the spine, how to align your spine, and that really helpful to your low back pain injuries. Now, let's talk about the knee pain and the injury. And so, the knee pain injuries is really important to strengthen the muscle around your knees, to check the knee alignments about your hip, your knee, your ankle joints are aligned, and that alignment and using a Pilates equipment, it's really helps you to improve the strength and the mobility of that joint. Now, shoulder injuries. To improvise the shoulder injury, the key factor are to learn a scapula stability. So you learn scapula stability, use a light load, have a close chain movements which are really going to improve your scapula stability, and there are exercises we give you to improvise the shoulder mobility. Now, hip pain or a tight hips. So hip pain and tight hips are very common. Nowadays, the lifestyle is not such that people spend more time in a sitting. So what is the key function? To stabilize the pelvis, to mobilize the pelvis, plus balance the muscle around your pelvis and strengthen them. So all Pilates equipments and the exercises really help you to strengthen the hip muscles. Postural issues. The postural issues you see nowadays, common injuries are the neck, shoulder, round back shoulder, the lower back pain, which is your compressed spine. So the Pilates method, the Pilates teaching methods, the principles really helps you to improvise the posture, reduces the muscle strain. So what we do, we strengthen the weak muscle and we elongate the tight muscle, and that really helps you to improve your posture. Post surgery rehabilitation. So we need under supervision a very experienced teacher. So in our team we have physios who are Pilates instructor, and post surgical rehabilitation. Yes, after once you get a clearance from the physio, from your doctor, then the Pilates equipment really take care of your stability, do a control movement. Plus, we have very good physios on the board who teach Pilates, and that really helps you to recover faster and get back onto your daily routine faster. Arthritis and the joint stiffness. Yes, again, in this moment, you need a lot of joint mobility with a very good control, which shall reduce the pain on your joint and helps you to strengthen the muscle around your joint. So all these Pilates equipments are really helpful to improvise the arthritis and the joint stiffness. Now, osteoporosis or osteopenia. In this is called silent disease. So we lose bone density in this and bones gets brittle, and high impact exercises can cause a fracture or a major injuries. So Pilates equipments are designed in such a way that you get a minimum impact on your system, yet you get a strength. So it really helps you to take care of your bones, and that impact really helps you to increase your bone density. Reformer Pilates or Pilates equipments, it is not just a workout, it is a system designed to support your body's healing. If you are dealing with the injuries or want to prevent them altogether, Pilates can be a long-term movement partner. So we have so many examples. I've been training people, but now remembering about Tarini. So Tarini had joined me with a knee rupture. She has fractured her patella. And of course, after physiotherapy, she has advised to do Pilates. Of course, Pilates on a reformer and on other equipments. And within a month, like in 3 months, she got back into her joint movements. Her knee movements got better. She started her regular activities, the functional activities, the squatting, lunging, and now she's a nature lover. So she liked to go for her trekking. She likes photography, so she goes in the tough terrain where the climbing is also difficult, and she lives a pain-free life. So there's one more case where Ankesh, when he joined, he really wanted to train by me only specifically because his particular injury, even I was little bit doubtful, but then as we started, within a couple of weeks only, we got the improvement. He started feeling stronger, and now we have reached to the point where he goes for he plays sports, he goes for the gymming and really hardcore gymming, and he got that confidence to push the body in a different dimension. So we practice Pilates and strength training together. In the next episode, we will go deeper into how to modify reformer exercises for the specific injuries. Don't miss it.